Up to 1 in 8 to 1 in 10 pregnancies can be defined as high risk. Hi, I'm Dr. Muniswaran. I'm a consultant obstetrician and gynaecologist, and I subspecialize in high-risk pregnancies known as maternal-fetal medicine. I'm here today to talk and discuss some questions and myths about high-risk pregnancies. Does morning sickness only happen in the morning? It's a common myth. No, morning sickness does not only happen in the morning. In fact, it is usually more common in the evening. So myth number 1, it only happens in the morning. Number 2, some people say that the more you vomit, the healthier the pregnancy is. That is also not true. Number 3, vomiting, although it may be normal in pregnancy, if the vomiting is affecting your quality of life, if it's affecting your daily activities, if you have got weight loss, that is never normal. It is best to speak to your doctor. It is a condition that can easily be treated. Question number 2, is caffeine safe for the baby? Yes, if you have it in the right amount. If one were to consume less than 200 milligrams of caffeine per day, which is equivalent to 2 cups of instant coffee, double shot of cappuccino, it is safe in pregnancy. Now, while we speak about caffeine, alcohol consumption at any level is not recommended. Active or passive smoking is not recommended. But what is important, apart from limiting your caffeine intake, exercise. At least 20 minutes of exercise daily, which is equivalent to 140 minutes per day, is safe and recommended during pregnancy. How many scans do I need for a pregnancy? If your pregnancy is normal and healthy, the recommendation is to have 4 scans. The first scan between 6 to 8 weeks to confirm your pregnancy, to ensure you're having one baby, to ensure your pregnancy is healthy, and also more importantly, to ensure that your pregnancy is inside the womb. That is the first scan. The second scan is done in the first trimester between 11 to 14 weeks. Although detailed scans are usually done at 5 months, a 11 to 14 week scan is extremely important to take a look at some common structures and some common birth defects which can be diagnosed at this phase. The third scan should ideally be done between 18 to 24 weeks, where you can take a look at the baby's heart in detail and some other abnormalities that is now easier to be detected at 18 to 24 weeks. And finally, if you're well, if you're healthy, if you're uncomplicated, the fourth scan should ideally be done between 28 to 34 weeks. This is important to ensure that your baby is well grown, your baby is not small, and also to identify some abnormalities that actually evolve and perhaps was not there at 18 to 24 weeks of pregnancy. What do I need to know about high-risk pregnancies? Although 90% of pregnancies are well uncomplicated, up to 1 in 8 to 1 in 10 pregnancies can be defined as high risk. Now, what makes you high risk? If a mother has got an underlying medical condition, an underlying surgical condition, or a genetic condition, that makes her high risk. Or problem number 2, a mother can be perfectly well, but she may develop some complications in the pregnancy, such as diabetes, thyroid, preeclampsia, and that makes your pregnancy high risk. If you do have a previous adverse pregnancy outcomes, a previous preterm delivery, a previous fetal loss, that also makes your pregnancy high risk. It is best to speak to your doctor, to see an expert, ideally before conceiving, so that we can reduce your possible complications and improve pregnancy outcomes. Which weeks are most prone to miscarriages? And if it happens, how do we deal with one? Having a miscarriage, especially in the first 12 weeks of pregnancy, can be devastating. As healthcare professionals, as family members, as friends, it is important to provide them with emotional support, psychological support. As for patients, although 1 in 6 pregnancies or 1 in 6 patients may have a miscarriage, it is important to understand that most of the time, it is not because of something that you did or something that you did not do, and most of the time, it does not reoccur by itself. Having said that, if someone has got recurrent miscarriages, which is more than 2 miscarriages consecutively, or if someone has got a late miscarriage, that is usually not normal, it's important to see an expert, exclude the genetic cause, look for possible recurrent causes, because with the right intervention, with the right treatment, this can be prevented. Having said that, if you had a miscarriage, do not suffer in silence. Speak to your friends, speak to your partner, speak to your doctor. Mental health is just as important as physical health.